Hi there. Hi, this is Dr. Myckatyn, West County Plastic Surgeons. Hi, this is Dr. Myckatyn, West County Plastic Surgeons, and today I'm going to be talking to you folks about mastopexy or breast lifts. Um, so, if you guys are watching this live and if you have any questions or comments, please feel free to type those in, and I will be happy to answer those for you. So, at first, I can kind of talk to you a little bit about what a breast lift is. So, essentially, a breast lift is a procedure, as you would imagine, that predominantly lifts the nipple and the areola of the breast, and then also some of the breast tissue higher up on the chest, higher up in relation to the fold underneath the breast that plastic surgeons refer to as the crease or the inframammary fold. So, who would want to have a breast lift? So, breast lifts essentially mean that there is essentially more skin than breast tissue. And as a result of that, the breast skin and the nipple drop down to provide sort of an older or less youthful shape to the breast, or more ptosis, as we say. So essentially, the whole concept of a breast lift is essentially to change that ratio between the amount of skin and the amount of breast volume. And of course, there are sort of two ways you can do that. You can either reduce the skin, which is what we do in a breast lift, and reposition the tissue, or you can increase the volume, which is what we do with breast implants. So certainly, sometimes breast lifts can be done in conjunction with a breast implant. So the most common, or the main location that there's are scars and breast lifts are going to be around the areola for sure, and most commonly also a scar like a stem that runs underneath the areola towards the lower fold of the breast. And sometimes, in addition to that, will also include a scar along the lower crease of the breast. So the reason why there needs to be a scar around the areola is because essentially we're moving it. And since we're moving it from one area within the skin of the breast to another area within the skin of the breast, we need to be able to transfer that. And so we have to separate it from the skin, and therefore there has to be a surgery performed to do that, and that's what leaves the scar. The scars are underneath the nipple because that can allow us to sort of push the breast up, but that also is helpful because it means that even in a bikini or even nude, most of that scar is concealed since it sits below the nipple. The reason that sometimes we need to place a scar in the lower crease of the breast underneath the breast is to in situations where we need to remove even more skin, or we need to control the distance from the fold of the breast to the nipple. So that's kind of why those scars are done. In general terms, breast lifts are performed with people under general anesthesia, and those operations can take anywhere from 60 minutes to 90 minutes, typically, depending on the extent of the lift and if we're doing other procedures with that. So, the most common thing that we'll do with the breast lift would be to add a breast implant. Now, certainly you don't need to have a breast implant when you have a breast lift, but there may be some reasons why somebody would choose to do that. One would be when we do lift up the breast tissue, again, we're not adding anything, so we're just redistributing what was there already. So there can still be some relative hollowing in the upper part of the breast, especially in somebody whose breast has been stretched out either from weight gain and weight loss or from breastfeeding. And so, in order to try and restore some of that extra shape to give a bit more fullness to the upper part of the breast, we can add a breast implant for that reason. And of course, the other main reason would be if somebody is looking to have a larger breast and a lifted breast, we would put an implant in with the lift. Also, sometimes we do sort of an addition subtraction, or we call it a augmentation reduction type of procedure. And the reason we would do that is if somebody is trying to create a rounded breast, position the nipple higher, but isn't really interested in being significantly larger overall. So the implant is used to try to get some of that fullness on the upper part of the breast. The lift is used to bring the nipple so that it's central on the newly formed and shaped breast. And then we reduce some of the breast tissue in the lower parts of the breast, sort of where our patient may not want it, and the implant is used to add the volume in the upper part of the breast where they may want it. Breast lifts can also be done in other ways. Sometimes we'll use support structures like meshes to help hold the natural breast tissue up, and sometimes that can be used instead of an implant, especially if somebody really doesn't want the implant. And then another thing that we can do is we can also inject fat into the lifted breast to provide a little bit of breast augmentation using one's own tissue. We can't make the breast as large if we do it that way as we could with an implant, but it is a way to avoid an implant and get a little bit more fullness, or also to perhaps address some contours or some ripples, or provide a more natural look to a breast lift with or without an implant. So those are some of the main things. Also, we will do breast lifts in patients frequently with a tummy tuck, or with other procedures like arm lifts, for example, as well. Typically, when somebody has a breast lift, they go home the same day, so they do not require an overnight stay unless that breast lift has been combined with some other procedures. Also, typically these days, we do not use drainage tubes when we do breast lifts. Most of the time now, also to try to reduce pain and to improve somebody's function so they're back doing their normal lifestyle sooner, there are several different things that we now can do. One of those is that we do nerve blocks before our patients wake up, and that can make them feel a lot less pain, and that can last for many hours after surgery. Another thing that we now do is this thing called enhanced recovery after surgery. So the whole goal of this enhanced recovery after surgery is to make it so people bounce back faster, they have less nausea, less fatigue, and also don't need to use usually any narcotic medicine, or certainly less than they would have in the past. So that's something that we do for breast lifts, as well as for essentially all of the cosmetic surgeries that we're doing these days. Before somebody has a breast lift, it's also good to consider, what their history of breast cancer is in their family. So certainly if somebody is 40 years old or older, we would recommend getting a mammogram. It's just part of good breast health and a good breast cancer screening. If somebody has a strong family history of breast cancer, particularly in younger individuals in their family, we may consider doing a mammogram before that, or diving a little bit deeper into their breast cancer and their family's breast cancer history. Beyond that, another common thing is the relationship between when you do breast lifts and breastfeeding. So one thing is that we want to make sure that when we do the breast lift, that it is performed so that when we do cut through the breast tissue, we don't run into issues with infections or cysts and things. So definitely somebody should not be actively breastfeeding during a breast lift, and typically we'll have wanted them to have stopped breastfeeding for many months before moving forward. It's pretty unlikely that a breast lift will cause permanent loss to feeling of the nipple. Typically, there can be a modest reduction in that feeling, which typically comes back within a few months. And then beyond that, as I say, most people are bouncing back to work from a breast lift really within a week or two. In terms of vigorous exercise, that may take a few more weeks, but people are up and about, walking around, even doing cardio, even within a couple weeks of a breast lift typically. Um, Thank you very much for paying attention to this presentation from West County Plastic Surgeons on breast lifts. Um, all of our videos are archived on our website, so please check back in if you want more information on another topic. And of course, we'll continue to update these topics as new information comes out every once in a while. Hope you're all doing very well and have a great day. Thank you very much.